Thank you for taking time out of your busy schedule to view this presentation on substance use, signs, symptoms, and resources for New Hampshire residents. We believe that the adoption of these core competencies into practice will improve the outcomes for children with behavioral health needs and their families. These foundational modules are developed to be viewed by family members, higher education students, paraprofessionals, and professionals. A list of resources and references have also been provided. This module will be presented by Kimberly Hislop, Training Coordinator, the New Hampshire Alcohol and Drug Abuse Counselors Association, and the New Hampshire Training Institute on Addictive Disorders. The New Hampshire Children's Behavioral Health Workforce Development Network is to build a sustainable infrastructure for the professional development of the children's behavioral health workforce based upon the core competencies and infused with the system of care core values and guiding principles. The need is for New Hampshire to have an adequate workforce and an infrastructure to support those who work with children, youth, and families. The New Hampshire Children's Behavioral Health Core Competencies were developed in 2011 by a representation of diverse stakeholder groups, including child-serving community mental health providers, family organizations, state policymakers, and university staff. The goal was that the competencies would be the first step in developing systematic and comprehensive human services development infrastructure. The competencies were developed using the system of care core values and principles as the foundation. There are 7 domains: family-driven and youth-guided practice, cultural and linguistic competence, childhood development and disorders, screening, assessment and referral, treatment planning, interventions and service delivery, systems knowledge and collaboration, and quality improvement. The competencies are organized for professional staff by levels of knowledge and skills in each domain. There are 3 levels: foundational, intermediary, and advanced. The levels are designed to identify the skill level of practitioners. They are fluid and not specifically tied to certain formal education and training or position titles. A copy of the report can be accessed, and a link is provided at the end of this presentation. This is one of a series of modules designed to support the development of core competencies in the children's behavioral health workforce. This webinar examines the common indicators of substance use and substance misuse in families and youth. It examines the first foundation level competency in the substance use category 8, recognizes situations when substance use may be present and may affect child or youth, and seeks supervision. The program closes with New Hampshire referral resources and references for further information, as well as a resource of information for practitioners. This webinar may also be a resource for parents and family members seeking information for a loved one.
In this presentation, we will discuss substance use, signs, symptoms, and resources for New Hampshire residents. Adolescents begin experimenting with drugs and alcohol at early ages. They may decide to experiment because of peer pressure, depression, low self-esteem, and stress at home. When a teenager is using alcohol and other drugs, there will be noticeable signs of use. Typically, there are physical, behavioral, and psychological signs of use. The average age that a child will experiment with marijuana is 14 years old, and some start experimenting with alcohol before 12 years old. Common drugs that are used in New Hampshire are marijuana, synthetic and non-synthetic, alcohol, prescription medications, inhalants, cocaine, crack, and speed, heroin, ecstasy, LSD, and PCP. Behavioral signs involve choices that youth make that are in contrast to their previous behaviors. These actions may be in contrast to their beliefs and values. Behavioral signs of substance use include a changing in one's physical appearance. This can be through a deterioration in personal grooming, but it can also be the choice of wearing articles of clothing that glorify substances. Youth may change their sleep patterns. Some substances will cause sleepiness and others may prevent any desire to go to sleep at all. As substance use progresses, youth may withdraw from their previously normal activities. For example, a loss of interest in extracurricular activities, sports, and hobbies, a change of friends and associates, and less attention to school assignments, which may lead to lowered grades and/or blaming that the teacher just doesn't like me. Parents may notice an unexplained need for money and secretive response about spending habits, which may include borrowing or stealing from family members and others, missing valuables that are being sold or pawned for quick cash, and missing prescriptions from the medicine cabinet. Other behavioral signs may include increased legal problems or increased problems at school. This could mean complaints from teachers and classmates. If they are working, there could be complaints from coworkers and the employer, and there could be an increase in fights, arguments, and illegal activities. There is a tendency at first to explain away or rationalize a child's behavior as being related to other factors. Unless someone is asking specifically about alcohol and other drug involvement, youth are unlikely to volunteer that they are using substances. A change in personality or attitude could mean clashes with family values and beliefs, increased problems with siblings, family members, and a sudden change in friends. There could also be a demand for more privacy, for example, locking doors, avoiding eye contact, sneaking around, and more time spent alone at home. The increased use of perfumes, air fresheners, and incense. Incenses and perfumes are often used to mask the smell of smoke, alcohol, or other drugs. Neglecting responsibilities. Youth will start neglecting their responsibilities to the family, school, or employment. They might start skipping work or school, flunking classes, and skipping household chores. They might start spending more nights away from home and be evasive, aggressive, or defensive when asked questions about their whereabouts. They start engaging in suspicious and secretive behaviors, such as lying about where they were, who they were with, where they are going, and when they will be back. Some physical signs can be bloodshot eyes or pupils that are smaller or larger than normal, frequent nosebleeds that could be related to drugs that are snorted. Some common drugs that are snorted are crushed narcotics, prescription medications, meth, and cocaine. Changes in appetite and a sudden loss or weight gain. Seizures that aren't common or caused from a pre-existing condition. An increase in injuries, accidents, and bruises that are unexplained. Unusual smells in the breath, body, or clothing. And shakes, tremors, incoherent or slurred speech, and impaired coordination. Psychological signs might be the most challenging to attribute to substance use with the average teenager. They are expected to have mood swings, hormone changes, difficulty navigating emotions, and get emotional about various situations. However, substance use may cause sudden mood changes such as irritability, angry outbursts, or laughter at nothing. Youth may have periods of unusual hyperactivity or agitation. They might also display a lack of motivation, inability to focus, or seem lethargic and spaced out. Youth using alcohol and other drugs may appear withdrawn, depressed, anxious, or paranoid with no apparent reason, unless substance use is known or discovered. Youth that misuse alcohol and other drugs can become dependent of the substance. Physiological dependence on a substance can be measured by tolerance, which means that over time more of the substance is needed to experience the desired effect, and withdrawal. As the effects of the drugs or alcohol wears off, withdrawal symptoms can be experienced. Which symptoms someone experiences varies depending on which substance or combination of substances they have been using. Common withdrawal symptoms include anxiety, trembling and shakiness, sweating, nausea and vomiting, insomnia, depression, irritability, fatigue, loss of appetite, diarrhea, body aches, and headaches. Drinking alcohol or using other drugs after a binge or period of heavy substance use is not uncommon in order to reduce the symptoms of withdrawal and to steady the nerves and stop the symptoms. Physical dependence of a substance means there is a loss of control. A loss of control is when there is a desire to stop but can't, neglecting activities, and continued use despite negative consequences. Continued use of drugs and alcohol, even though it interferes with activities, relationships, exercise, and social events, and is damaging to everyday life. Alcohol and other drug use make a big impact on the family, regardless of who is taking or using the substance. A parental figure in the home that misuses alcohol or drugs may model alcohol and drug use to the children, make it easier for children to access alcohol and other drugs, distress the family financially and legally, and at times place the family in a dangerous environment. Children with a biological parent that uses alcohol or other drugs is 4 times more likely to use substances themselves. Youth that use substances prior to the age of 15 years old are also at greater risk of developing physiological dependence. Drug and alcohol misuse by any family member may impact the family by disintegrating the family structure. It may lead to loss of job or failure at school, introduce stressors into the family environment such as aggression, violent behavior, and marital disruption, and it may lead to anxiety and depression in the family. There are many different options for drug and alcohol screening. The audit, the assist, the NIAAA 3-question screen, and more are all great options. In this presentation, I am going to discuss 2 common brief initial screens. The Audit C is a 3-question alcohol screen that can help identify those who are hazardous drinkers or have active alcohol use disorders. The Audit C is a shorter version of the 10-question audit screening. The score is based on a scale of 1 to 12, and each question has 5 answer choices. A score of 4 or more for men and 3 or more for women is considered positive. Generally, the higher the score, the more likely it is that the patient's drinking is affecting his or her safety. The 3 questions for the Audit C are: how often do you have a drink containing alcohol? How many standard drinks containing alcohol do you have on any typical day? And how often do you have 6 or more drinks on one occasion? The craft screening is recommended for use with adolescents. If the answer is yes to any of the 3 opening questions, then all 6 follow-up questions should be asked. If the adolescent answers no to all 3 opening questions, then the provider only needs to ask the first follow-up question regarding the car. The opening questions for the craft screening are: during the past 12 months, did you drink any alcohol, more than a few sips, smoke any marijuana or hashish, and use anything else to get high? The follow-up questions are: have you ever ridden in a car driven by somebody, including yourself, who was high or had been using alcohol or drugs? Do you ever use alcohol or drugs to relax, feel better about yourself, or fit in? Do you ever use alcohol or drugs while you are by yourself or alone? Do you forget things you did while using alcohol or drugs? Do your family or friends ever tell you that you should cut down on your drinking or drug use? Have you ever gotten into trouble while you were using alcohol or drugs? If an adolescent answers no to all three opening questions but answers yes to the first follow-up question regarding the car, then the remainder of the follow-up questions should be asked. When scoring the craft, each yes response equals 1 point. A score of 2 or greater is a positive screen and indicates a high risk for having an alcohol or drug-related disorder that may require further assessment. Once high risk is determined, treatment and resources should be considered. Next, we'll look at resources and treatment in New Hampshire. NA, AA, Al-Anon, and Alateen are free support groups for those whose lives have been or currently are affected by drugs and alcohol. Having a support network can often make the difference in maintaining a sober and drug-free life. Below are websites and phone numbers where you can access more information about each program, as well as meeting times and places. New Hampshire has self-help programs such as Alcoholics Anonymous, Narcotics Anonymous, Al-Anon and Alateen, the New Hampshire Assembly, Celebrate Recovery, Nar-Anon and Cocaine Anonymous, and Granite State Area Narcotics Anonymous. Outpatient services are provided in individual and group counseling sessions in non-residential settings. Average duration of services is about 90 days or less. There are many different drug and alcohol treatment facilities in New Hampshire, which can be looked up by town in the Bureau of Drug and Alcohol Services Resource Guide. You can also find providers through the New Hampshire Drug and Alcohol Counselors Association at www.nhadaca.org. Intensive outpatient services are in an outpatient setting for a minimum of 3 hours of direct client treatment services per day, utilizing both group and individual formats for a minimum of 3 days a week. Typically, this occurs for 4 to 6 weeks with less intensive services following. Short-term stays are designed to assist individuals who require a more intensive level of services in a structured setting and individuals that may be homeless. Voluntary admission with an average length of stay of 28 days or less. There are currently facilities in Nashua, Dublin, Keene, Franklin, Manchester, Dover, and Bethlehem. Long-term and extended care is limited to pregnant and parenting women and their children. Currently, there is the Cynthia Day Family Center in Nashua. Halfway houses and transitional living are designed to support individuals in the early stages of recovery that need this residential level of care, or for those that are homeless. The goal of these programs is to prepare clients to become self-sufficient in the community. Average length of stay is about 90 days or less. Residents typically work in the community and may pay for a portion of their room and board. There are currently programs in New Hampshire that specialize in certain populations such as teens, adults, men only, etc. The Phoenix House of Dublin specializes in children under 18. Peer recovery support services support an individual's recovery plan that prevents relapse and enhances or removes barriers to recovery. Recovery support services include guidance in financial management, parenting, vocational training, life management, and spiritual counseling, as well as transportation and childcare. Currently, there is the Dairy Friendship Center and the Avery Center. Eligible clients entered into ATR receive help with treatment at a contracted BDAS provider facility, outpatient or intensive outpatient counseling, recovery support services, and other life skill services. In conclusion, alcohol and other drugs make a big impact on youth and their families. It will affect their everyday lives, and there will be signs and symptoms of their use. Paying attention to the signs and symptoms, using simple screening tools, and knowing the resources available will make a big difference. You can find more information about resources available in New Hampshire from the Clearinghouse at the Bureau of Drug and Alcohol Services in Concord, New Hampshire, as well as the New Hampshire Alcohol and Drug Abuse Counselors Association at www.nhadaca.org. I hope you have enjoyed viewing substance use, signs, symptoms, and resources for New Hampshire residents.